Hi, and welcome to another video update from the Fire Brigades Union. Once again, joined by General Secretary Matt Wrack via a video conferencing facility due to the COVID-19 lockdown. Now, Matt, we're here to discuss a further update in regard to what's become known as the tripartite meetings between the Fire Brigades Union, the National Fire Service Employers, and the National Fire Chiefs Council. You've been in these talks again all week. It's resulted in a further agreement, the fifth agreement since this crisis began, and a further series of additional work that firefighters can undertake have been agreed. There's three areas. Can you outline for us what they are?
Okay, hi Sam, and hello everyone. So we've got three new areas, as you say. One of those, the first of those is to engage in non-blue light ambulance driving. So that's transporting patients, for example, to outpatient appointments to relieve pressure on NHS ambulance services. Secondly, to assist in testing for COVID-19. Obviously, we've been calling it for a great deal in terms of testing, the importance of that for testing key workers, fire rescue service staff, NHS staff, but wider testing. So it's about playing our part in that as well. And then thirdly, about fire and rescue service driver instructors engaging in driver training for ambulance staff. So that was all of those were identified at local level and fed up through that tripartite structure, and we've managed to reach agreement. Again, I would urge people to read the national agreement, and I would urge people to read this particular national agreement relating to these activities, because there are guidance notes written into the document, and there are protections again built into each of those activities for our members who might volunteer for each of those activities.
Now, Matt, you mentioned testing, and just hot off the press, I know the union's been engaged heavily with the Home Office, the Department of Health and others in regard to getting fire service personnel and their households access to testing, and it's just been agreed from this weekend. What do you think that's going to mean for FBU members?
Well, I'm pleased that the Westminster government has reacted to the lobbying by ourselves as the Fire Brigades Union and by other unions and other organisations for a wider testing regime. It's obvious that if you have a key worker system, as we do, NHS staff, our members required to carry on going into work, but other groups of workers as well. If you're asking people to go into work, you need a better testing regime, a systematic testing strategy across the country to deliver a key worker strategy as well. So we're pleased that the government has responded finally. I have to say it is a little bit too late. We wrote on the 20th of March, first of all, to ministers all across the UK. And we'll have to see whether it goes far enough, whether they can deliver the number of tests that are required, because, and I think you're going to cover this elsewhere in other video reports, but it is important that we have a national testing regime that people can understand and that people can have confidence in.
Now, Matt, just finally, this is clearly an extraordinary time for firefighters and the public alike. What lessons do you think have been learned as a result of this crisis, both within the fire and rescue service and indeed wider society?
Well, I think it's very interesting. Early on, one of the first points we made to our own members was the actual lack of emergency planning that lay behind this in the fire and rescue service, but also in other public services. And I think it's interesting, if you follow the media debate, I think that point is hitting home far wider nowadays. I think many people are commenting this scandalous lack of PPE in our National Health Service. Well, emergency planning means that you should plan for national emergencies, and it means that you should address what would happen to your staff numbers, and things like PPE are an absolutely obvious point if you are planning for a crisis like this. So there shouldn't be shortages, or the government should have had plans, the National Health Service should have had plans, fire service employers should have had plans for how do you deal with these shortages as they emerge, and what mechanisms are put in place to ensure that that is addressed as urgently as possible. So I think that lack of emergency planning is something that we're going to have a major national debate around. Secondly, I think the impact of austerity. We talk about resilience. Resilience is precisely the ability of an organisation to deal with wider challenges. So how can the fire service deal with incidents that are beyond the normal? How can the health service deal with incidents that are beyond the normal day-to-day demand? and COVID-19 is precisely that sort of challenge. And resilience means the ability to adapt, meet challenges to the organisation and so on. And while we're talking about resilience, we've actually seen devastating cuts in our public services, which means that all of us are are less able to deal with these challenges than we would have been a decade ago, because we would have had in the fire service 12,000 more firefighters ready to meet this challenge. Similar story in education, similar story in local government, and a similar story in the National Health Service. So I think there are big political lessons to be learned from the COVID-19 crisis. But of course, we've all got to pull together to get through the crisis in the first place.
Matt, thanks very much indeed. We'll look for more updates on the clearly substantial work that the Fire Brigades Union is undertaking on behalf of its members. Please go to our website. That's simply www.fbu.org.uk. For more immediate updates, you can go to our Twitter site, and that is simply @FBU National. So next time, thanks for joining us, and Matt, thanks very much indeed.
Thanks, Tam. Thanks, everyone.